Hi, I'm Dr. Halsema. Thank you for joining us today. Today we're going to visit with Deb, one of my hygienists, and she's going to be giving us a little lesson on how to floss and brush your teeth.
Hi, I'm Deb. I'm going to show you the correct way how to brush your teeth. First thing you want to do is start in a corner of your mouth that is the same place every time. That way, if you're not paying attention to what you're doing, you're going to remember where you are. If you want to start in the upper corner of your mouth, what you want to do if you're using a manual toothbrush is take the brush and angle it towards the tooth and the gum, about a 45-degree angle, and get the bristles up on the gum. That way you're going to be able to massage the gum and clean the part of the tooth that's next to the gum. You give a little push and flex the bristles a little bit, and the bristles are going to go up underneath the gum and in between the teeth as best as you can do. Do a little circular massage, and then you want to roll what you've removed off the tooth away from the gum. So it's a little circular massage and then roll away from the gum. You'll probably get a couple of teeth every section that you do, and then overlap the sections and just move around your entire mouth. Top teeth first if you want, but just go around and do a circular scrub and then roll away from the gums. Make sure that you don't brush down into your bottom gums though. Okay? You're going to do that on the outside and on the inside. Always remember to point the bristles towards the gums, do a little circular massage, and then roll the bristles away from the gums. When you get to the front teeth, on the inside, you're going to have to put your brush this way and do your same thing. A little circular massage, and then roll the bristles out away from the gums. Okay? And remember to do outside and inside on both the top and the bottom arch. Okay? And then you can scrub on the chewing surfaces. Now, when you get done brushing your teeth, you're going to also want to make sure that you brush your tongue, because bacteria collects and food particles will collect on your tongue. So the easiest way to do it is, if you have your brush in your hand, just take your brush and roll the bristles down on your tongue in one direction. Okay? Don't scrub back and forth, but just roll them down in one direction. A better way to clean your tongue is to use what they have. Carry these are tongue scrapers. There's a variety of different kinds. This is ones we have here. What you would do with this is you would fold it in half and then place it on your tongue and move it outward towards the tip of the tongue. And you'll be removing anything that's collected on your tongue. After you brush your teeth and you brush your tongue, you're going to want to make sure you clean in between your teeth, because your brush can't reach all the places. So the best way to do that is with floss. If you're able to use your hands to floss your teeth, what you want to do is wrap the floss, you get about a piece that's about 18 inches long, and wrap the floss around your middle fingers. That way you have your thumb and your pointer to guide the floss. And what you'll do is, if I can show you on here or not, but you want to take the floss down between the teeth using a back and forth motion, kind of sawing back and forth until you get through the top part of the tooth where it touches the tooth next to it. Okay, so it's a back and forth until you get through the point where the teeth touch. And then you want to curve the floss like you're making the letter C, and go up and down the side of the tooth that you're cleaning off, up and down the side of the tooth as far as you can, and then go up and over the piece of gum tissue, and then go up and down the side of the tooth next to it. So you're not just removing what's stuck between the teeth, but you want to actually be cleaning off the sides of the teeth, because that's where your plaque is going to still be, because your brush can't reach those places. And then you want to just saw it back and forth to get out between the two teeth. For those of you that have a hard time using floss, there's a variety of different floss aids out there on the market. Here's one that we have. It's called a breech flosser. It comes in a little package like this, and it's got a long handle, so it makes it easier for cleaning the back teeth. And all you would do is just take it between the teeth. So again, saw it back and forth until you get through that little clicking point on the top where the teeth touch, and then take it down, up and down motion, pulling it towards the tooth in front to clean the back side of that, and then pushing it backwards to get the front side of the back tooth, and then out. Okay. If you have areas where food gets caught, where your brush and your floss doesn't really remove that very well, there's other aids you can use. This is called a Sulca brush, and it's angled on the top and the bottom. The way it's angled on the top would help you to remove food particles from the cheek side of the tooth, okay? And it's a tuft of bristles that are pointed, so it'll get in between the teeth really good. And then the way it's angled on the bottom is good for the inside, and that'll help you to remove food that's stuck in between the teeth. And even down here in front, it's hard to reach these teeth, so the way that's angled on the bottom, using the tip of this will help remove anything that's collected on the inside of those teeth. There's also another interproximal cleaner called a proxy brush, and this has a little pipe cleaner with bristles on it. It's not as sturdy as the Salka brush, but it's a different way to clean in between your teeth. It'll go in between your teeth like this and help to clean the sides of the teeth. It's whatever your preference is, whichever one you want to use. When you're out to lunch or when you're working and it's not feasible to get the brush and floss out, there's also little aids that you can use to clean in between the teeth. This one is a little wooden toothpick called a Stimident, okay? And it's an orange wood stick that has a flat bottom and a curved on the top. This would be the edge that you use against the gum. And all you do is use it in between the teeth like this. Make sure you keep the tip on the tooth so that you're not ramming it down into the gum. And that'll help to clean out anything that's stuck between your teeth while you're away from home. This other aid is called a Rotapoint that we have here at our office. It's just like this wooden toothpick is, but it's plastic. It's a little flexible on the end. Again, the bottom flat part is the part that you would put against your gum. And we have these here at our office. Use it the same way. Keep the tip on the tooth that you're cleaning off. Okay. If you have any bridge work or wires that are behind your front bottom teeth, there's little loops called Floss bridge flossers. And it's like a little plastic needle. And what you would do with this is take your floss and thread it just as if it was like you're threading a needle. And then you would take the little blue tip and feed it between the teeth and then pull it through from the inside. And that brings the floss through. And then you can just take the blue loop off and you can rinse that off with Listerine and you can use it again. And then wrap your floss around your middle fingers and floss like you normally would. Do the sides of each tooth and then out. I think I've pretty much covered all of it. So happy flossing.